COVID-19 summer surge, what you need to know. COVID-19 is making a comeback this summer, and it's a wake-up call for everyone. According to the latest data from the Centers for Disease Control and Prevention, CDC, the virus is on the rise in no fewer than 26 states plus Washington, D.C. This summer surge is not just a blip on the radar, it's a clear indication that the pandemic is far from over. But here's where it gets controversial. Despite the rising numbers, experts are quick to reassure us that the new variants, Nimbus and Stratus, are no more deadly than their predecessors. Yet, this doesn't mean we can afford to be complacent. Far from it. The CDC also notes that COVID-related emergency room visits for young children are at their highest since March. This is a stark reminder that while the virus may not be more dangerous, it can still hit vulnerable populations, including young children, the elderly, and those with compromised immune systems, hard. So, what should we do? The good news is that the vaccines we have are effective against these new variants. However, the CDC's recommendation for booster shots is now more nuanced, urging shared clinical decision-making rather than a blanket, get vaccinated, directive. This shift has sparked debate among health organizations. For example, the American College of Obstetricians and Gynecologists strongly recommends pregnant individuals get vaccinated to protect their unborn babies, who are currently relying on maternal antibodies for protection. The bottom line. It's time to take a closer look at your vaccination status and consider the latest guidance. Should you get a booster shot? Should your children? The answer isn't straightforward, and it's something that deserves a conversation with your healthcare provider. But here's the part most people miss. This summer's surge isn't just about numbers, it's about understanding the evolving nature of the pandemic and making informed choices. So, let's talk. What do you think about the current COVID-19 recommendations? Do you agree with the CDC's approach, or do you think it's time for a different strategy? Summer COVID-19 surge, what you need to know. Get ready, COVID isn't done with us yet. Epidemiologists confirm the feared summer surge in cases has officially begun, according to startling new CDC data. This isn't just speculation, it's a clear pattern emerging in the numbers that demands our attention. The latest figures reveal an unmistakable uptick in COVID-19 infections across the country. While many hoped warmer weather might suppress transmission, the virus continues circulating at concerning levels. This parallels previous summers where heat failed to stop viral spread, reminding us that seasonal patterns remain unpredictable. Public health experts emphasize that despite widespread immunity from past exposures and vaccinations, new variants continue evolving enough to drive these recurrent waves. But here's what many overlook: this surge arrives as pandemic fatigue has left most people relaxed about precautions. While some epidemiologists argue this mild wave won't overwhelm hospitals, others warn that dismissing it outright could leave vulnerable populations, like the elderly and immunocompromised, disproportionately at risk. This tension between normalization and vigilance creates a genuine dilemma. Should we treat COVID as an endemic nuisance or remain on high alert? Where do you stand? Are these summer surges becoming the new normal we should accept, or do they signal an ongoing threat requiring renewed caution? Share your perspective below. This debate affects us all.